How to answer different MMI scenarios using the STAR method. Here is our first question. To begin our answer, we want to provide a clear and concise sentence introducing the different issues within this scenario. For example, in this scenario, I'm a medical student dealing with a difficult situation where my patient is confessing to me that she no longer wants to take her prescription medication and instead wants to try alternative remedies. There are a few main issues I need to consider today. Firstly, I want to consider her immediate safety. What is her condition that she is taking her prescription medication for? Is she in any immediate danger by stopping this medication? Secondly, I need to consider that she has confessed this to me behind her treating doctor's back, so I have to consider patient confidentiality before going straight to tell the doctor. Thirdly, I need to consider what these herbal remedies are and why she wants to try them. What has she heard about them online? Is she not satisfied with her current prescription medication? Or is she potentially experiencing side effects that she doesn't like? Providing this clear introduction using the STAR method allows us to have a really solid start to our response. Next, we want to move on to T, task. What do we actually need to do in this scenario? The first thing to consider is having an open and non judgmental conversation with Mrs. Khan surrounding what her concerns are about her current medication and why she wants to try these herbal remedies. You want to begin this conversation by asking those open questions. What are these herbal remedies that you've read online, Mrs. Khan, and what do you think that they'll be able to do for you? What are your current concerns with your prescription medication, and why have you decided to stop it? And why haven't you told the doctor yet? Are you afraid that he might tell you that you can't use these herbal remedies, or what are your concerns there? Having these open and honest conversations with Mrs. Khan allows her to feel comfortable to confide in you about her concerns with her medication. And it could be that in the past she has had negative experiences with healthcare providers where maybe they've shut down her desires to try herbal remedies. So it's really important that you are open and non judgmental here, allowing her to express her desires around her care. We always want to consider patient autonomy as our number one priority when having these open conversations. Now, it's important to remember our role here. We are only a medical student, so we cannot actually provide a diagnosis or treatment for Mrs. Khan. We can only have these conversations. Therefore, we want to encourage Mrs. Khan to have this conversation with her doctor. You could make her feel more comfortable by offering to go to the consultation with her if possible. Ask her why she is concerned about telling the doctor if she's worried that he will react poorly to her having stopped her medication. And if so, you really want to comfort her and encourage her to talk to the doctor, letting her know that the doctor will respect her autonomy and the decisions she makes around her care.